Kettlebell deadlifts work your glutes, back extensors, lower back, quadriceps, hamstrings, adductors, core, trapezius, and grip and forearms. To start off, we want to make sure that the kettlebell is between our ankles and that our feet are a little bit wider than shoulder width apart. When we grab the kettlebell by squatting down, we want to always remember to hinge at the hips and never arch our back because that can cause back strain. Keep our chest up and our shoulders back. We want to feel a stretch in our hamstrings. We want to make sure that our hamstrings and our glutes stay tight throughout the whole deadlift. Lift up, keeping that back straight. We don't want to ever arch our back. And then lift back down until your hamstrings feel a stretch. For patients who are newer to the exercise, we can have them tap a box with a kettlebell for cueing purposes. You can also just advise them to squat down until they feel a stretch in their hamstrings, so they might pause about right here. I'm going to do one more. Three important things to keep in mind when doing a kettlebell deadlift are that you never ever want to arch your back. You always want to make sure that your back is staying straight throughout the entire exercise. If a patient begins arching their back, they may have tight hamstrings. In that case, you can advise them to only go down to where they feel a stretch in their hamstrings or have them tap a box for cueing purposes. You also want to remember this is not a squat, so you always want to hinge at the hips and keep your core activated. And finally, do not overextend your back because if you lean too far, that can lead to back injury.